Uh, when do we have to like turn on cameras? We have to
Yeah,
do it
yeah,
normally.
you have to do it. We'll edit it.
Okay.
देखो we are live on YouTube, ठीक है? কিছু বলছো? देखो before we start a few instructions, all of you please read the chat. ठीक है, अभी मैं वहाँ लिख रही हूँ. We are starting in just 1 minute. So finally, here we are. Okay, I think my video is not clear. So let's start. Yeah. Supporting the survivors, admiring the survivors, educating every individual by text, audio, and visual. A very good evening to one and all present here. I, Megha Chattopadhyay,
And I, Mansi Anand.
heartily welcome you all to this initiative of Advanced Healthcare Foundation for commemorating World Cancer Day today through this webinar, The Experts Talk You versus Cancer. We have our honorable guests, speakers, directors, and volunteers here with us on Zoom, and lots of enthusiastic people participating in this from YouTube Live and Facebook.
Every year, 4th of February is observed as the World Cancer Day all around the globe. It is to make people more aware of cancer and encourage them to educate themselves more about this disease. In this webinar, we have invited esteemed doctors having expertise in their respective fields who will be talking about different types of cancer, causes, precautionary measures to take, and mental health. We had also conducted poster making and poem writing competitions on our Instagram handle for World Cancer Day. Results will be shared with all of you gradually. And the winners will be serenading us today with their writings as part of our open mic event. Hence, we are in this together and we will together create a future without cancer.
To start with, we invite Dr. Shreya Chattopadhyay, Director of Advanced Healthcare Foundation, to kindly address the online audience.
Thank you, Megha. Namaskar. Wish you a very good and healthy evening. Today is World Cancer Day, which is observed all over the world to create awareness of cancer. As we keep hearing, cancer can be cured if detected early. To commemorate World Cancer Day, we are here on a mission to save some more people by creating awareness about cancer and its early detection. Advanced Healthcare Foundation has taken up the initiative to create cancer awareness among general people through this webinar. We also wanted to engage the next generation through poster making competition and poem or story writing competition. And I am happy to tell you that we have received a very good response from the youth of India. Today, we are fortunate to have some of the most prominent doctors among us who will enlighten us about cancer, prevention, emotional challenges, and the right diet to be followed. They have kindly agreed to spare their valuable time so that we can fight against cancer. We also have some cancer survivors with us who are leading normal life like others. We are grateful that they have agreed to inspire us by sharing with us their experiences. Beside this, we have our esteemed guests who are here today to support the cause. We have our young volunteers of Adolescence Club who are showing their responsibility towards the society. On behalf of Advanced Healthcare Foundation and on my personal behalf, I thank you all for your support towards this noble cause. Thank you.
Thank you, ma'am. I now invite Dr. Saurabh Kole, our Director of Advanced Healthcare Foundation, to kindly address the online gathering.
Megha, please check he
Yes,
is
I
there or
just
not because he is some
no, I
problem.
just received a message from him that he's facing
Exactly,
some network issue.
exactly.
Okay. So hence we are in this together and we will together create a future without cancer. Over to you, Mansi.
To begin today's event on a positive note, we will now have our first live performance of the evening. For this, I invite Adya Kapoor, a brilliant writer and poet who has bagged the second position in our open mic contest. Let's all welcome Adya with virtual claps and cheers.
Good evening, everyone. Am I audible?
Yes, you are.
This is the poem that I wrote, The Unbreakable Warrior. Little do we
Yes, Adya,
know
we can hear you.
what they go through. The cancer patients, the warrior who no one ever knew. The pain and the chemo, the suffering that you can never know. The family starts to shatter and their mental health is in shambles. The stress of the treatment and the financial aid that seems to be at the end. We give hugs and say that we understand them. Reading about Gus and Hazel made us think we know all about it, but little do we know what they go through, the pain and the chemo, the regular check ins with the doctors, and the chemo buddies they make anew. Something that they share is the loss of their beautiful hair. Little do we know what they go through. The fake smile on mom's face at the dinner table, the sympathetic look on the passerby's face. They take it all in and still do not lose hope. They are unbreakable, strong as coral. They fight and they will win because little do we know what they go through. But in the end, with the perseverance and hope, they will come through. Thank you.
Thank you so much, Adya. That was indeed very heart touching. We all know that the lungs are the center of the respiratory, that is the breathing system, right? And every cell of the body needs oxygen to stay alive and healthy. And our bodies also need to get rid of carbon dioxide. But what happens when this important breathing center gets affected by cancer? So we now invite Dr. Rajesh Gupta to kindly tell us about lung cancer. He is currently the additional director, Department of Pulmonology and Intensive Care at Fortis Hospital, Noida. He has over 2 decades of experience in the treatment of respiratory diseases. He is also a well renowned critical care specialist with expertise in management of critical conditions like septic shock and multi organ failure. Over to you, sir.
Good evening, everyone. I hope the presentation is visible on the screen. Uh,
Yes,
so,
sir, it is.
yeah. So today is World Cancer Day. Uh, Nothing to celebrate about, but okay, it puts stress on the importance of cancer in the uh, general population, and also uh, gives us methods to prevent cancer, because prevention is better than cure. So we are beginning the day with the possibly the worst form of cancer, which affects the lungs. So if we go back to the history, the origin of the world cancer comes from the crab, animal crab. So Greek crab means cancer. So Hippocrates, who is the father of medicine, he gave the name carcinos or carcinoma to non-ulcer forming or ulcer forming tumors, and the Greek word for crab is cancer. So later on, another Roman physician, Celsus, he gave it the name cancer, and later on, Galen, he coined the term oncos, and the current mm, terminology of oncologist comes from that. So we know the physicians who deal with cancers are called oncologists. What is lung cancer? So any cancer, for that matter, is a group of cells which starts dividing on their own, and the body loses control of their division. So that is cancer. So it starts when abnormal cells grow out of control in the lungs. They can invade nearby tissue and form tumors, masses. So this looks like a normal lung, and something like a mass you get here is a tumor. So the cancer cells, they can stay in the lungs, or they can metastasize to the lymph nodes or to other parts of the body. They break away, and the small tumor cells, they go to other parts of the body. Why lung cancer is important? Because lung cancer is the leading cause of cancer related mortality in the US. The data in the US says In 2019, 1,40,000 deaths were caused by lung cancer. So if we extrapolate this to Indian population, that would amount to around 6 lakh people dying of lung cancer every year in our country. So that's a huge number. So even in the entire COVID pandemic, we have seen like 1.5 lakh deaths. So 6 lakh deaths every year because of lung cancer, something which can be possibly prevented. What causes lung cancer? Well, it was established long back that smoking is the largest risk factor for lung cancer. So if we see this data, as the incidence of smoking went down in US, so was the incidence of lung cancer going down in the US. And the other cartoon shows that non-smokers, if they have zero risk, the risk increases as the number of cigarettes consumed per day or BDs or tobacco consumed per day increases. So it exponentially increases the chances of getting lung cancer. Why? Because tobacco smoke contains at least 70 carcinogens. Carcinogens are substances which make these cells undergo changes or they cause cancers. So these carcinogens, they damage lung cells, and over the times, the damaged cells can turn into lung cancer. So more of a person smokes and longer one smokes, the higher are the chances of the person getting lung cancer. And whenever the person quits, so it's never late to quit. Whenever the person quits, the risk of lung cancer starts reducing. Though may it not fall to normal, but it definitely reduces. The other causes of lung cancer, apart from smoking, include radon. Radon is a radioactive gas usually in the basements and godowns. Workplace chemicals, asbestos. Asbestos was a huge cause of lung cancer. Air pollution. So I would say a word about air pollution. In the NCR and in a country, the pollution levels are deadly. So in the worldwide, they say 8 out of 10 are related to smoking. But a study by Gangaram Hospital showed that in Delhi NCR, 50% of the patients who are diagnosed to have lung cancer are non-smokers. So half of the people are getting lung cancers who are non-smokers, and attributably because of the high level of pollution or the polluted air we are breathing. Genetics, definitely the genetic or the way our body cells behave has an important role to play. Radiation. So radiation, you may have heard, is a treatment for cancer. Repeated radiation is a risk factor for cancer. And people who have COPD or pulmonary fibrosis, they are also at risk of developing cancers. What are the symptoms, or how do we know that there's possibly a problem with the lungs? Cough, wheezing, breathlessness, chest pain, spitting out blood. So these are like general symptoms for any respiratory disease. But someone who coughs out blood, TB or malignancy according to age should be high on the cards, and we should not neglect it. So because these symptoms are so general, there's usually a delay in presenting, and therefore we diagnose lung cancer in a much advanced stage, which is very, very bad. There are a number of complications the lung cancers can present, like a pleural effusion or water in the lungs, collapse or collapse of a part of the lung. There can be water around the heart, or there can be obstruction of the airway pipes. So these are the different types of uh, presentations the lung cancers on CT scans appear. There are two types of lung cancers. Mainly, one is called a small cell lung cancer. The other group is called a non-small cell lung cancer. So small cell lung cancer contains 4 or 5 varieties of cancers, and non-small cell has a better survival. Small cell has a very poor survival. So as we look at these data, so someone who is diagnosed and has a localized disease means the disease is limited to one part of the lung only. So the 5-year survival rate is in tune of 56%. But if the uh, local metastasis nearby areas the tumor has gone, the survival reduces to half, 29%. And look at the red one. If this is the tumor has spread to the distant part of the body, only say 5% people survive 5 years of life. So lung cancer is definitely one of the deadliest form of cancers, and it is therefore very, very important to prevent lung cancers from happening. So the outcome mainly depends on the stage or the extent of spread of the lung cancer when it is diagnosed. So early detection of lung cancer becomes very important. If you look at this cartoon which showing the 5-year survival rate, the bar chart showing 5-year survival rate depending on the different stages of lung cancer, these two 92, 83, 77 or 68. This is the type if someone presents, then a surgery is possible. So surgery is not possible beyond this group, beyond stage 2 or 3 or 4. So surgery is sometimes curative, but if the uh, tumor has spread and surgery is not possible, that means it's going to be bad. So the survival rate is going to be very, very low. How is lung cancer diagnosed? We discussed the symptoms of respiratory involvement. Then if someone visits a doctor, we usually order a chest x-ray. If the chest x-ray shows something suspicious, we may do a CT scan. So these are the basic tests which help us detect the structure of the lung, whether there's any abnormality or not. So depending on what we find on the chest x-ray or CT scan, we formulate a plan to get small pieces of tissue which we call biopsy. So small pieces of tissue from the lung are obtained by different methods like a bronchoscopy, which is endoscopy of the lung, or EBUS TBNA, which is an ultrasound guided biopsy from the lung, ultrasound or CT guided biopsy from the outside, or by the pleural fluid. So if these tests tell us that there is a malignancy or a lung cancer present, then we do some advanced tests which include a PET CT. So PET CT is a whole body CT scan with a special type of fluorinated glucose used, which helps in detecting the spread of the cancer to other parts of the body. And then there are some genetic mutation studies which help us identify the type of cancer, and accordingly the treatment can be planned depending on the stage and the type of malignancy. How is lung cancer treated? So there are two methods of two outcomes of a treatment. One is curative. So curative is it's gone, it will not come again. So you cured the malignancy. In case of lung, unfortunately, in the last 30, 40 years of advancements in science, the outcome of lung cancer has not changed much. A lot needs to be done. So curative therapy is possible only in the group where surgery can be done. So group 1. So stage 1 is amenable to surgery. So only that is called a curative treatment. The other part is called a palliative. Palliation means to reduce the effect of the tumor. You cannot cure it, but only give some palliative therapy so that the effects of the tumor are reduced to some extent. And this all depends on the type of cancer, stage of cancer, age of the patient, and overall health of the patient, whether someone is able to take a chemo or not. So various modalities which are used are surgery, radiation, chemotherapy. There are some targeted therapy, laser, photodynamic, some surgical, local surgeries with a cryosurgery. So these are all technical methods of trying to reduce the tumor load. Then in the West, at least there is a concept of hospice palliative care, because there's a large chunk of patients who have advanced tumor when they are diagnosed, and there's a possibility that the treatment may be more painful than just not doing anything. So there are special setups called hospice palliative care setups are there, where we can possibly spend the whatever time is left. So lung cancer is so bad that majority of these patients, they fall into a palliative category of care, and they need something like a hospice care, which unfortunately is not very well developed in India. We need to the government or the private setup, we need to set up something like a hospice care for patients who have advanced disease and which is not curative anymore. So the main important thing about lung cancer is prevention, prevention, prevention. So if you prevent lung cancer from occurring, then that's the best scenario. And the most important thing in preventing lung cancer is one, not to smoke. So right from the school programs or education programs, people should be encouraged never to smoke. And those who are smoking, they should quit smoking because they are at very high risk of a deadly cancer. So if you look at this chart, at whatever age someone stops smoking, the risk starts reducing. So it's never late to stop smoking. So some people say, अब इतने साल हो गए, why should I stop? So it's never late to stop smoking. And stopping smoking not only prevents lung cancer, it prevents a number of other diseases as well. Then we should be aware that we are not exposed to asbestos, arsenic, or second-hand smoke at our workplace or home. For those to tell you is second-hand smoke means uh, the someone else is smoking and someone who is sitting nearby inhales the smoke. So that is called the second-hand smoke. And the science tells that second-hand smoke is deadlier than smoking. So one should be very careful with the people who smoke, not to be around them, especially in closed rooms. Check the radon levels in the home. We should avoid unnecessary radiation exposure by chest x-rays or CTs. Diet, definitely everyone should be taking a healthy balanced diet, and there is no special diet as such to prevent lung cancer in particular. Eating a balanced diet will help you uh, prevent not only lung cancer but stay healthy and also prevent a lot of other diseases. So eat healthy, eat fresh fruits and vegetables every day, whole grains, stay hydrated, and have adequate amount of protein. So this is a healthy diet for everyone, not only just to prevent lung cancer, but to prevent any form of disease. So anyways, we all should have healthy food. Then there are certain home treatments which can be advised or taken care of at home: nausea and vomiting, diarrhea. So these are simple home remedies which we should focus on when the uh, aim is to just palliation or someone who is undergoing a chemotherapy or radiotherapy is going through. So quitting smoking is very, very important. There are some complementary treatments like acupuncture to relieve pain, meditation to relieve stress, light massage, breathing exercises. So these body mind treatments, they make people feel better. They help to cope up with treatment of pain, and we should always discuss all this with the doctor before starting these. So let us stay strong and let us beat lung cancer. And one, those who have never smoked should never smoke in their life, and those who are smoking should quit smoking. That is the most important message to stay away from lung cancer. Thank you.
Thank you so much, sir. Sir, could we open the floor for questions?
Yeah, sure.
Sure.
So I would invite any questions.
Thank you, sir. So, those who are there on YouTube, you can type in your questions in the live comment section. And those who are there as our volunteers over here in Zoom, you can pick questions from there and ask them. So, we'll be taking two questions this time. Over to you.
So we'll be getting in the chat box.
No, sir. We have volunteers, sir. They'll be asking. Who is
Okay.
asking this time?
Hi,
Tanish?
I
sir.
think
I'm Sakshi.
Okay.
Sir, my question for you is: does the cancer trigger heart after lungs, since it is the nearest?
Well, for a contrast, the I think the burden of the heart is taken by the lung. So heart is one organ which rarely sees cancers. So in the lighter vein, I would say all the burden of the heart is taken away by the lung. So heart is not possibly a very common site for cancers. So
All
in
right,
the
sir. Thank you,
ladies,
sir.
they should be aware of breast cancer and cervical cancer. So those are the most common ones, and heart is a rare organ for getting a malignancy.
Thank you, sir.
Yeah. Second question, please.
Who is asking the second question?
that'll be me.
Yeah,
Yeah.
sure.
Please go ahead.
Hello, good evening, sir. My name is Tanishk, and the question that I have is lung cancer, as we know, is largely asymptomatic, and people often live with it for many years. And even though they have certain symptoms, they may seem it as very trivial or any other disease.
Yeah.
Now when we realize, I mean it's mostly what happens is ki when we realize that we've got the cancer, it's already too late. So what is the other way to find out prior to proper diagnosis?
Yeah. So this is a very important question. Uh, See, in India, a lot of people are suffering from tuberculosis. So if we look at the symptoms, they are the same as those of tuberculosis. So most of the people, they think they have got TB. Most of the doctors think that this is possibly TB. So I did in my research work, I had found that there is at least a 4 months delay in presentation. 4 months after you get overt symptoms, right? So actually the delay may be much longer. And this is the worst part about lung cancer, because most of the cases which are detected in stage 3 or 4. So you cannot cure them. So worldwide, there are certain programs which run like a population screening with low dose CT scans. So in some countries that is done very well. Although this has not shown very brilliant results in reduction of lung cancer, Japan has a very successful program on detection of lung cancer. So there are certain programs which are run by the governments in their population, mainly including X-rays and low-dose CT scans to detect early in high-risk cases. So high-risk group will be people, say, who are more than 40, 50 years of age and who have been heavy smokers. So in that population should be targeted for screening, right? And second important thing is awareness. So we should be aware of our body and our symptoms, and we should not shy away in contacting a doctor or a healthcare person whenever we get any significant symptom.
Okay, thank you,
Yeah.
sir.
Welcome. Welcome to
Thank you so much, sir. It was really an honor for us to have you here with us.
the pleasure was mine, honor was mine.
Thank you, sir. Now, you all know what we are going to say next. So, hence, we are in this together and we will together create a future without cancer. Well, you are not just a survivor, you are a fighter, a warrior. Embrace your spirit, keep faith in your heart. Laugh a lot, indulge in confidence, grow with each tear, breathe in positivity, walk around with grace and dignity, because at the end of the day, you are not like the common people. You are a warrior. So now we'd like to invite one such warrior to hear what she has to share with us. Before that, to celebrate her unparalleled spirit, let's have a glimpse of her dance, which she recorded during the days of her treatment.
सारा जड़ी गोता वाली
That was indeed wonderful, wasn't it? So now I invite Jyoti ma'am to please share her experience with us.
Good evening, everyone. The name cancer itself is very scary. The same happened with me also. When I heard this news, I was in shock for almost a month, and I was never ready for the treatment. And treatment also was very very painful when I started this. But जैसे कहते हैं हिम्मत करने वालों की हार नहीं होती लहरों से डरकर नौका पार नहीं होती. My mother, who is also a breast cancer patient, she gave me support. She told me that when I can take this treatment, why not you? मैं देखो मैं भी तो ठीक हूँ ना, तो तुम भी हिम्मत रखो. And it's true when many times I lost my courage and I said no, I don't want to go through this treatment because my age was. Like I was when I detected the cancer, my age was just 46 years. But I got support from everyone, family, friends, relatives, and most important thing, I thought my husband can spend money and my family can give me support, but I have to collect my inner strength, and then only I can fight with this disease. And after some time, when I got stable, I started going to office. I kept myself busy and never left my hobbies. This dance video which I recorded is after my treatment, just when I completed my treatment. And recently also I have undergone one more surgery. I want to say to every patient that don't lose your hope, don't think that you cannot take this treatment. Just keep believing in yourself and God. And everything is possible. हर बीमारी का इलाज possible है. We have very very good doctors, and in India no treatment is possible. I just want to say few lines when I got completely bald. मेरी सुंदरता का तो क्या कहना, ये मैंने तभी लिखी थी जब मेरी सिचुएशन ऐसी थी कि हर कोई बाहर नहीं जाना चाहेगा या किसी से मिलना नहीं चाहेगा. बट आई नेवर थॉट लाइक दिस. मेरी सुंदरता का तो क्या कहना, मेरा न्यू लुक बन गया है मेरा गहना. अब भीड़ में भी मैं अलग नजर आती हूँ, हर किसी को अपनी प्रेजेंस का एहसास करा जाती हूँ. मेरी पार्लर वाली है बहुत इतराती, ज्योति जी बिकॉज ऑफ यू अपने पैकेज में नया स्टाइल ऐड कराती. पल भर तो मुझे जीने दो, थोड़ी देर तो हंसने दो, कैंसर की इस पीड़ा को खुशी से सहने दो. थैंक यू सो मच. थैंक यू.
Thank you so
Thank you
much,
so much,
ma'am.
ma'am. Thank you so much for being with us today and sharing your
Thank you.
experience. A
Thank
lot
you.
of love, respect, and power to you.
Thank you.
Hence, what we learned today remains the same. We are in this together, and we will together create a future without cancer.
Now let us interact a bit, people. Anyone who would like to answer, kindly answer in the comments on YouTube Live or raise your hand here on Zoom. Now, do we all know about the uterus? Yes, somewhere in our biology textbooks we must have read about it, seen in the diagrams given, right? So, okay. So, what is the uterus commonly known as? If anybody here knows the answer, raise your hand or just unmute yourself and speak.
Womb.
Yes, very good. It is called the womb, where the mother carries the child, right? And what is cervix? If anybody remembers, I see a hand raised. Anupriya, yes, please.
It's the lower part of the uterus.
Right, absolutely right.
Now, the innermost lining of the uterus, called the endometrial lining, and the cervix can develop tumors, uterine cancer and cervical cancer, respectively, both of which are pretty common in India. The relatively better news is there is vaccination for both of them. So let's hear about it all from Dr. Devyendu. He was the consultant gynecologist at Bhagirathi Neosia Women and Child Care Center, Columbia Asia AMRI. He's also the HOD department of ONG Charnock Hospital and president of the Bengal OBs and GYN Society 2019-20.
Yeah, good evening. Could I be allowed to share my screen?
Yes, sir, sure, that is enabled.
That is enabled, right. Can you see it?
Yes, sir.
Okay, thank you. Well, today we'll be talking about screening and prevention of cervical cancer. Why cervical cancer? Cervical cancer is the second most common cancer amongst women in our country. Now, as Frank Herbert had said, the beginning of knowledge is discovery of something that we do not understand. Now, what exactly is cancer? Just a minute, I'll just minimize this. What exactly is cancer? Cancer is an uncontrolled growth of certain cells in the body causing tumors or growths. But remember that not all growths are cancer. Those cells which may spread to other parts of the body and can interfere with the normal function of that part of the body is called cancer. So the message that should go out is not all tumors are cancerous. Cancerous tumors are the tumors who've got the propensity of spreading from the original site to a different site of the body. Now, what exactly is cervical cancer? You were just talking about it, that uterus is known as the womb. Cervix is the entry point to the womb. So cervix is the mouth of the uterus. It is a cancer that begins in the cervix, which is said to be the mouth of the uterus. Now, what exactly is cervical cancer? In cervical cancer, cells on the cervix begin to grow abnormally, and sometimes, when not treated, they become cancer. The funniest part is from development of abnormality in a cervix to overt cancer, it takes around 10 to 15 years. So our patient has got around 10 to 15 years to be aware, to be careful, to be detected, to be treated so that she can be fine. Only it is when it is detected at a later stage that you've missed the bus. However, these early changes can disappear on their own without any causing any problems. Now, what causes cervical cancer? Now, why exactly are we talking about cervical cancer? Because this is the only cancer where we know that there is a definite organism or there is a definite cause. For other cancers, there are related causes. Smoking may be related to lung cancer. In breast cancer, you have a genetic predisposition, but it is only in the case of cervical cancer that now we do definitely know that there is a predisposing factor, and that predisposing factor is a notorious virus called human papilloma virus or HPV. Approximately, there are about 15 to 20 high risk types which are associated with cancer, and there are around 10 to 15 low risk types which are associated with genital warts and other benign lesions. Most of the time, HPV infection disappears without treatment. Sometimes, unfortunately, it stays in the cells for years. And in some of those women, it eventually changes the genome of the uterus, of the cells, and leads to cervical cancer. Now, why exactly are we talking about cervical cancer? Cervical cancer disease burden in India is huge. India has a population of 436.76 million aged between 15 years or older who are at a risk of developing cervical cancer. And unfortunately, India accounts for about 1/4 of cervical cancer cases and deaths worldwide. We get around 122,000 new cases annually. It's the second common female cancer and second most common female cancer in women aged between 15 and 44 years. Now, cervical cancer mortality in India is the second cause of female cancer deaths and the second leading cause of cancer deaths in women aged between 15 and 44 years. And can you imagine there are 67,000 plus deaths annually due to cervical cancer even today. Approximately 185 women die every day. Approximately 8 women die every hour, and a woman dies every 8 minutes. Such is the severity of the disease, the severity of the burden of disease in India. Now, what exactly causes cervical cancer? Now, HPV, as I said previously, human papillomavirus is the necessary cause of cervical cancer in 99.7% of the cases. There are two varieties. The commonest varieties is HPV 16 and 18, which are the oncogenic types, and HPV 6 and 11, which are responsible for anogenital warts. So HPV 16 and 18 causes more than 75% of cervical cancer and more than 50% of vaginal and vulval cancer, whereas these non-cancer causing types 6 and 11 lead to 90% cases of anogenital warts. Now, how exactly is human papillomavirus transmitted? It is sexually transmitted, genital skin to skin contact. So it can be said that it is a form of a sexually transmitted disease. It can also be non-sexually transmitted from the mother to the child and through fomites. Now, who exactly are at risk of developing cervical cancer? A young age, at first sexual intercourse, you begin your sexual life very early in your life, greater number of lifetime and recent sex partners, sex with a new partner, a male partner sexual history. Why? Because unfortunately, males harbor the HPV virus. They do not have symptoms, but they are the carriers and they infect you. And in addition to sexual behavior, other potential risk factors include smoking, oral contraceptive use. Once again, this is very, very debatable, and nutritional factors. Now, what are the signs of cervical cancer? Early cervical cancer usually has no signs, which is why screening is so important. Most of the patients, more than 90% of the cases, patients who are detected with cervical cancer never had any signs, never had any symptoms. But the signs which can be there are vaginal spotting or bleeding after sexual intercourse. That what in our medical terms we call postcoital bleeding, bleeding in between menstruation, that is intermenstrual bleeding, and bleeding after onset of menopause. And there may be a foul smelling discharge that does not go away even with treatment. Now, how is cervical cancer diagnosed? Screening is the most important, foremost thing. It is a test which is done on people who are healthy and who are asymptomatic. That means they have no symptoms. And it is done to identify those who have a higher risk, higher chance of getting a particular disease. A cervical cancer screening test can determine if the cervix is normal or it is abnormal. It can detect the early signs of disease before a woman has symptoms, when treatment can prevent the disease from development. So it has got a preventive role. Well, what exactly is done during screening? It is no big deal. The most common test is the Papinicolas pap smear. A physician does a gentle examination to look at the cervix, collects a sample of cells from your cervix and sends it to the laboratory to be examined. It previously used to use a spatula. Now it's a simple brush, which takes around 30 seconds to do. And in most of the cases, it is done by paramedical staff. Other tests that are commonly used to screen for cervical cancer, such as looking at the cervix after putting vinegar or Lugol's iodine, is called VIA or VILI. But the most commonest test that is done is a pap smear test. And in the Western world, after 30 years, it is mandatory for every woman to go and get a pap smear done. Unfortunately, in our country, with the huge population burden that we have, it is only an opportunistic screening rather than an universal screening. An opportunistic screening means if a patient comes to us, we say, have you had a pap smear done? She says no. We say, just go to the next room and get it done. Can cervical cancer be treated? Most cervical cancer can be successfully treated if it is found early. In middle-aged women who have never been screened, cancer may be discovered late and well already when it has spread beyond the cervix and it is more difficult to treat. Now, treatment options. What are treatment options? It may be surgery, it may be radiation, it may be chemotherapy. Surgery in the earlier phases, it may be ablative, a small outdoor surgery, or cryosurgery, or a carbon dioxide laser surgery. You may do an excisional procedure, local excision of that point without removing the uterus. There may be a cone of the cervix removed. You may remove the uterus as a whole. And if the disease has spread beyond the uterus to the bladder, to the rectum, then you need to remove everything, followed by radiation or chemotherapy. Now, can cervical cancer be prevented? This is the most important part of this talk this evening. Yes, cervical cancer can be prevented. How? Number one, by education. Number two, by screening. And number three, by vaccination. Why vaccination is very important? Because this is the only cancer against which we have got a reasonable vaccine which works wonderfully. Now, education. What is education? Education is this talk. Education is level, increasing your level of awareness. Education is a public awareness talk to reach out to the masses, telling them that people may not be aware of the tremendous burden of the disease. People may not know that every 8 minutes we are losing a woman due to cervical cancer. That they do not appreciate the magnitude of the problem caused by cervical cancer. People may lack accurate information on its natural history, detection, and treatment. Natural history means it takes around 10 to 15 years from infection by HPV to development of overt cervical cancer. So you've got a huge window of opportunity for treatment. Many women and men have not heard of cervical cancer and do not recognize its early signs and symptoms when they occur. And women at risk may not be aware of the need to be tested even when they do not have any symptoms. Now, vaccination, that is the most important thing. Why vaccination? HPV vaccines are highly effective at preventing the infection of susceptible women which HPV types covered by the vaccine. HPV vaccine should be given to females before they reach an age when the risk of HPV infection increases, and they are at subsequent risk of cervical cancer. To make it simple, that females should be vaccinated before onset of sexual activity. HPV vaccine should ideally be given in the age group of 10 to 12-year-old girls as per the recommendation of Indian Association of Pediatricians, but our parent body of gynecologists, the Federation of Obstetrics and Gynecological Societies of India, recommends that HPV vaccination at various stages of women's life, starting from 9 to 45 years of age. I am delivering patients who had never had this opportunity of getting vaccinated when the vaccination was not done when they were between 10 to 14. So now they have delivered, they're vaccinating the children, and I'm telling them that vaccinate yourself against this disease. Because even if you vaccinate yourself now, it would be more than 95% protective, and most of them go for it. So HPV vaccine is given at 2 to 3 doses, depending on the age of the recipient. If the girl is less than 14, she can get only 2 doses, that is on day 1, and repeat the dose after 6 months. And if she is above 14, she needs 3 doses, that is day 1, 2 months later, and 6 months later, over a period of 6 months. So the key points today is, this is the take-home message that you need to take. You need to propagate among your friends, among your relatives, that cervical cancer is one of the leading causes of cancer death in Indian women. The primary underlying cause of cervical cancer is infection with human papilloma virus, which is a very common virus. And most HPV infections resolve spontaneously. Those that persist may lead to development of precancer and cancer. It usually takes around 10 to 20 years for lesions caused by HPV to develop into cancer. Over 80% of the women are newly diagnosed with cervical cancer live in developing countries, and most are diagnosed when they have advanced disease, unfortunately. And if left untreated, cervical cancer is almost always fatal. HPV vaccines are highly effective at preventing the infection of susceptible women with the HPV types covered by the vaccine. Thank you.
Thank you so much, sir. That presentation was indeed very information. We were very honored to have you here today.
Thank you.
Now we'll open the floor to questions. So over to you, Divyana and Kesar.
Okay, so if I may ask the question, good evening, sir.
Yeah, good evening.
Thank you for such an informative session. My question is that, is it possible for this vaccination to be available to women and girls from weaker sections of society? Is it possible?
Yeah, basically, I can tell you two things. It is not a very cheap vaccine. In India, it is available in the price range of 1,800 to 2,000 per dose. The government has not yet. Remember that we've got a huge population, so it's not possible for any government to give it at a free price. But there are negotiations going on with the central government, with the Ministry of Health, by our parent body, that is FOXI, to subsidize the rates for younger children. And I feel that it should be a part of the national immunization program that is adopted in our country.
Thank you so much, sir.
Good evening, sir.
Yeah, good evening.
Another question. Does the cervical cancer affect the anus or the urinary bladder? How effective are such cancer vaccines?
Look, this cancer vaccine, if you're talking about the anal cancer, the HPV also causes anal cancer. So if you give this vaccine, you are almost more than 75% protected against anogenital cancers. That is vulval cancer, vaginal cancer, and anal cancer. In cases of cervical cancer, the protection is to the tune of 99.9%. But in cases of anal cancer or vulval and vaginal cancers, the protection rate should be above 75%. For any cancer, if you've got a protection rate of 75%, you should be happy with it.
Thank you, sir.
In Australia, in Australia, this cancer has been approved for use for men. That is the only country that has approved the use of HPV vaccine for men, because this HPV has also been implicated in the as a causative agent for penile cancer.
Thank you so much, sir.
Thank you, sir, for the wonderful presentation, and thank you so much for your time. Thank you for addressing all our questions.
Thank you.
Moving on, we now move on to our next participant, who is one of the best four entries for open mic, and she will be performing for us now. The virtual stage is ready for our second runner-up, Dhruva Ray.
Dhruva Ray, do we have you with us here? I had admitted you, so... Yes, you're
Okay, am I audible now?
Yes, you're audible.
Hello, am I audible?
Yes, ma'am, you're audible.
Yes, you're audible.
Yeah, sorry, I was on mute. So okay. So thank you very much for having me in this forum. And I am, I am a working woman, but in my as a hobby, I sometimes do pen down some short stories. So this is my second attempt at an audio story. So please pardon me in case I sound nervous. And before I start my story, a few pointers I would like to share with you all. All my stories are written in English, and they are short so that when you read or listen to them, you do not take more than 2 to 3 minutes. Even though the stories are written in English, but they are all titled in Hindi, and I generally try to give the names in line with the Hindi movies. And as the story progresses, when you listen to the story, it feels like just like one day in our life, very usual stuff. But then there's a twist, and this twist comes right at the end. So I would request all of you to be patient till the end so that you don't miss out on the twist. Uh, the title of this story is Ek Duje Ke Liye, the famous movie that we all know about. And it's a story about two sisters. And it is I've written the story in the form of a chronology of events that take place in the life of these two sisters. The story starts somewhere in the year 2018, February 2018 to be precise. Okay. Why are you using my pen? Mommy gifted it to me. It's mine. Trisha snatches the pen from Krisha. Why are you so possessive? You also use so many of my things, don't you? No, I don't want to share. Trisha puts the pen in her bag and the fight continues. April 2018. Mummy, why have you cooked curry today? You know I don't like it. Trisha charges at Aruna. I'm very happy she has done it. I love curry. Krisha relishes her food as she winks at her sister. I know Mummy loves you more. Why? She even makes egg curry, which I don't like at all. Krisha counters, and the fight continues. May 2018. Why are you wearing my dress? Mummy bought it for my birthday. Krisha rushes towards her sister. Mummy told me I can wear it sometimes. Also, you wore my jeans a few days back. Trisha refutes. I know Mummy is partial towards you. And the fight continues. August 2018. Mummy, I don't want to sleep with her. She keeps pushing me out of the bed. Trisha complains. One of you can go and sleep with Dadi if you want more space. Aruna offers to find a solution. Mummy, you believe her? Have you ever seen how much space she takes up on the bed? Trisha, if you have a problem, you can go to Dadi's room. I am not budging from my place. Krisha retorts and the fight continues. September 2018. Trisha, do not disturb me now. I am watching this musical show. Krisha warns her sister. No way. It is time for me to watch the Sherlock Holmes serial and I just can't afford to miss it. Trisha states categorically. Then you go and watch with Dadi or Mummy. I am not changing the channel now. Why should I go? If you have a problem, you move out. And the fight continues. December 2018. Krisha, please switch off the light. I need to wake up early tomorrow for my exam. Trisha requests. I'm using the table lamp and I cannot switch it off now. I have to study. If you have problem, use your eye mask. Krisha snaps. I can't find the mask. Have you seen it? You never arrange your things. It remains strewn all over. Mummy has told you so many times to be more organized. Don't disturb me anymore. Just get back to sleep. Krisha adds angrily. Okay, you just wait and watch. I will do the same when it's my turn. Trisha replies, and the fight continues. February 2019. Mummy, I want a bicycle for my birthday. Trisha announces at the dinner table. Beta, this year it might be difficult. We will get it next year. Aruna responds softly. Then why did you get a laptop for Krisha? Trisha questions indignantly. Beta, she needed it for her studies. It was an essential, not a luxury. Aruna tries to rationalize. I don't believe you. It's just that you love her more. Trisha storms out of the dining room. I really don't know why they always have to fight. I thought boys are more aggressive, but I get tired just resolving their fights the whole day. Aruna smiles at Prakash as she gently holds his hand. April 2019. Doctor, please check her. She doesn't want to go to school these days. Keeps complaining of headache, doesn't feel hungry, and always remains irritated. Okay. I'm suggesting some tests. Get them done, and I'll check her after 1 week. After 1 week, I have checked her thoroughly and must share with you that Trisha is suffering from brain cancer. I have consulted with the oncologist as well. The silence in the room is deafening. Well, it is scary. I can understand. But let's not lose hope. We have to fight against the disease. The doctor continues. The good news is it is in the early stages, and considering her age, we are optimistic she'll pull through. So please cooperate with me. June 2019. I can still remember the day when I complained that they always fight with each other. Now Trisha remains so quiet throughout the day. How I wish they fight like the old days. Aruna tries to control her tears as she sits alone in the puja room. July 2019. Let me share some good news with you. The surgery has been successful. Trisha will now undergo chemo over the next 3 months. This is going to be difficult as the chemicals play havoc with her internal systems. But Trisha is doing great. So please continue the fight and we will overcome the crisis. The doctor encourages. November 2019. Trisha, beta, how do you like the lehenga? I bought this for Diwali. See, the color suits you so well. Aruna puts on a smile on her face as she tries to pep up her daughter. It is nice, mummy, but I can't wear it with a bald head. Trisha makes no attempt to hide her tears as she painfully recollects the long tresses lost to the chemo treatment. If I can wear a sari with a bald head, why can't you? The mother daughter duo spin around as Krisha walks into the room, donning a peacock blue kanjivaram and sporting a clean shaven head. Krisha, what happened to your hair? Trisha cries out. You always claim that your hair is better than mine. So let's see whose hair grows back better. Krisha winks back and the fight resumes. Thank you.
Thank you so much, ma'am. That was indeed very touching story.
Thank you.
Thank you. Every 4 minutes, a woman in India is diagnosed with breast cancer. With 1.38 million new cases every year, breast cancer is definitely one menace which threatens female all over the world with infections and the possibility of death. However, preventive measures can always help and keep ourselves in check. To tell us more about breast cancer, we have Dr. Ullash Batra, who has obtained his DM in medical oncology from the prestigious Kidwai Memorial Institute of Oncology. He has gained widespread experience in the management of various malignancies like breast cancer, gastrointestinal cancers, and hematological malignancies, etc. He is currently a senior consultant and chief of thoracic medical oncology at Rajiv Gandhi Cancer Institute. A very warm welcome to you.
Thank you, Megha, and thanks everyone. So I'll ask the most important questions in this pandemic. Am I audible and am I visible?
Yes, sir. You're both audible and visible, and your screen is also visible.
And the third most important comment from my side is I have got vaccinated. I hope everybody gets vaccinated soon. That's very important. So I don't know who are all going to be the audience for this. So I just thought I'll keep it something to do with breast cancer, some myths and facts about breast cancer. People can pitch in while I speak about it. So why is it important? Because as you said, 240,000 patients are diagnosed every year in India. Every 3 minutes, a woman gets diagnosed with breast cancer. Every 12 minutes, a death occurs of breast cancer. And 70% of cancers do occur in women who have no identifiable risk factors. People said कि अरे मुझे तो आज तक कभी जुकाम भी नहीं हुआ, directly cancer कैसे हो गया? So yes, 70% of cases do occur in women who have got no identifiable risk factors. Now, why some women develop breast cancer and some others do not, we don't know. But what we do know is that you have not done anything wrong in your life to which causes breast cancer. You do not catch breast cancer from anyone. You can always stand next to them, sit next to them, feed, share a plate, clap, examine. And people come into us and say कि क्या मैं इनके साथ खाना खा लूं, क्या मैं इनकी care कर सकती हूँ? The answer which I give usually is, I also have a family. I have 2 daughters. If it was that communicable and contagious, I would be the first one not to touch you for the safety of my daughters. So most women do not have any risk factors or history of breast cancer in their families. And getting older does increase your chance of getting breast cancer starting at the age of 40s and continuing into 80s. So people, again, as I was telling, they say कि आजकल आज तक कभी hospital नहीं गए और directly ये कैसे हो गया? As you grow older, the chances of getting breast cancer do increase. That is one thing which we need to remember. There's a good point about it. Women never get older. I've never seen a lady who is more than 40 years of age. After you reach 40 years of age, you go back to 39, 38, 37, 36. But just in case your CBSE board certificate says you are above that, chances of anybody getting breast cancer actually does increase. So what is the most common risk factor of getting breast cancer? It is actually age. As you grow older and the fact that you're a woman, 1 in 8 women will be diagnosed with breast cancer in their lifetime. This is the Western statistics. In India, 1 in 20 women will be diagnosed with breast cancer if they reach till the age of 70 to 80 years. That's the most important thing. And getting older does increase our chances of getting breast cancer. So finding a lump is the only way a woman can detect breast cancer. It's actually a myth, because 20% of cancers do not form a lump, and cancer can be there even if it's like this. So they can have nipple discharge, they can have discharge or bleeding, they can have a change in the size or contours of the breast, they can have a change in the color or appearance of areola, they can have the inflammatory skin like the skin of an orange. So lump is not the only thing. Observe the axilla, observe the nipples. If you have a bloody discharge from nipple, people can have breast cancer with that also. Again, so I put some myths and facts over here. Breast cancer is a genetic or a hereditary disease. Again, that's some myth, because it is hereditary only in 10% of cases. 90% of people will not have any history of breast cancer. So then comes the most important, said that, doctor, I am getting my routine blood test every day. I get a CBC, LFT, KFT every time. Everything is normal. I think this report is wrong. Nothing in the blood test to suggest that I've got breast cancer. Unfortunately, the presence of breast cancer cannot be detected by routine hematology and biochemistry exchange. You need to, there is no blood test at present which can detect this. Again, a myth or a fact, there's a vaccine against breast cancer. Absolutely false. There is no vaccine against breast cancer. There's a vaccine against cervical cancer, but not against breast cancer. That's something which is important. So how do you diagnose breast cancer? We diagnose breast cancer by 3 things. You have history and physical examination, you have imaging, and you have the pathology which comes over here. Now, imaging is very, very important. We have to get a mammography done, and that's how a mammography looks like. Unfortunately, most women in India, if whatever the audience is, only 20% of women actually undergo mammography. This is how the mammography actually looks like. So I will tell you an example. A patient whose mother has just been diagnosed with breast cancer is just 32 years old, the daughter. Mother is 65 years of age. She's very concerned about getting her own chances of getting breast cancer. So what does she do now? She doesn't come to me. She doesn't come to surgeons. She doesn't go to a normal physician. She goes and consults Dr. Google. Dr. Google is very, very easy to access, and and then they come with at least a 50-page thing about what all things can be. And Dr. Google tells her, if you have a lump in the breast, do a mammography, which is absolutely false. Because mammography is not indicated for all age group of women. It is only indicated above the age of 40 years or 50 years. Because if you are young, if you have dense breast, there is no point in getting a mammography done. So mammography has to be done only after the age of 40 to 50 years. Again, a myth or a fact. People say, my people in my home also do not get a mammography done, and say that because mammography itself can cause cancer. Again, a myth, because the amount of radiation which is given during mammography is very low. There is no evidence that mammography itself causes cancer. Again, a myth and a fact. Negative mammogram means that you do not have cancer. Again, false, because even if you have one normal mammography, 15 to 20% of cancer may be missed on mammography. That is why you need to do a mammography once in a year or 2 years after the age of 40 or 50 years. So this is the benefit of mammography. If you do a routine mammography, you can actually find out the breast when you have only 1.1 centimeter. And if you do not do this, if you do a breast self-examination accidentally, you have to get the breast lump will be palpable if you when it reaches the size of 3.6 centimeter. The difference between 1.1 and 3.6 is breast conservation surgery versus maybe an MRM, chemotherapy versus no chemotherapy, 98% survival versus 92% survival, all if we can get a mammography done very, very regularly. I think we all know this lady, Martina Navratilova. I was a huge fan of her. She has won 9 Wimbledon titles. Do you know that she actually got a mammogram done and was diagnosed with breast cancer, underwent a lumpectomy, was saved off chemotherapy, and went ahead and won another Wimbledon after that. So if she can do it, why can't you? Only thing is you have to get a mammography done. The other, so I spoke about how do you diagnose breast cancer? 3 ways. History, we spoke about imaging, about mammography, then we speak about biopsy. So the moment you utter the word biopsy, people take a U-turn and they run out of the clinic saying that the moment we do a biopsy, agar needle dalegi to cancer jo hai phail jayega. Now nothing can be further away from truth. Cancer does not spread as a result of biopsy. Tell me one thing, if you take a sampling from your vein, does the blood continue to keep flowing from there? No, it doesn't, right? So biopsy is nothing but putting a small needle inside the tissue, and that is the most important factor. In fact, I'll stick my neck out and say, if there's a person who's willing to start your treatment without a FNAC or a biopsy, I think you should have second thoughts on it, even if it is me, definitely. So let's look at a patient. She has just got a 3 by 3 centimeter lump in the breast, mammography done, FNAC done, which is positive for malignant cells. And again, since we are talking about myth and fact, there's a fashion in Delhi nowadays. So there are 2 fashions in Delhi which are going on right now. One fashion is to have an agitation for everything. I'm not going to go into that. The second fashion is to get a PET scan done. People come and tell us, doctor, I got operated and they didn't even do a PET scan done for me. So PET scan is not indicated in early stage breast cancer. So there are 4 stages of breast cancer. For stage 1 and stage 2, you do not need a PET CT scan. For stage 3 and stage 4, you need a PET CT scan. But for stage 1, stage 2, you do not. Again, if the patient has got a 3 centimeter lump, should we conserve the breast or should we remove the entire chest? So I have a very nice anecdote to share. I come from a family of non-medicals. And when I was joining my oncology training, somebody asked my father, I'll tell you, and he said, in cancer, you should take out as much as possible so that, it doesn't come back. Well, I agree with my dad on everything, but not on this, because there is no way that modified radical mastectomy or removal of the entire breast is better than breast conservation. Breast conservation is absolutely simple and should be preferred if your oncologist feels that they can have a margin. And in fact, the trials have shown that there is no, so there were trial which basically, we all hear of COVID trials and stuff like that. This is the trial. Out of 1,000 people, 500 got MRM, 500 got BCS. The end result after 20, 30, 40 years. And if you look over here, the years of follow-up are 20 years. After 20 years of follow-up, BCS and MRM was by and large the same. So this is how an old one looks like, and the figure on the right is how a new surgery looks like. If you have an option between an Ambassador and an Audi, I think I am definitely going to go for Audi. So if it is in my hands, I will definitely want to do a breast conservation surgery for most of my patients. So let's say that surgery was done for this lady. It was a T2N1. That means 1 lymph node was positive. X-ray, ultrasound, abdomen was normal. And the patient is referred to a medical oncologist. And I am a medical oncologist who basically gives chemotherapy. And the moment we utter the word chemotherapy, this is what I look like to a patient. And the patient basically feels that chemotherapy, there is no way that I'm going to take chemotherapy from you. And there are common myths and facts about chemotherapy, like, it is painful. Chemotherapy is absolutely not painful. You are bedridden most of the times. Absolutely not. There are a lot of doctors, there are a lot of people who have taken chemotherapies and they do their routine work. It's just a one-day daycare or admission procedure. People say hair loss is permanent. Absolutely not. After 4 months, you will get your hair back again. It is done under anesthesia, so people came and there was a patient who came and told me two funny things. He said, one, doctor, chemotherapy has not been done. I said, no, it was done. He said, but I was not taken under OT. How did you do chemotherapy? So chemotherapy is done in a daycare procedure. You and your family members are there. You can watch TV, you can listen to music. And the second thing which he came and told me was, doctor, should I get a ambulance on the way back so that patient doesn't suffer for that? The patient can in fact drive after going back from chemotherapy. It's not at all painful or not. You are virtually under house arrest. No, you are not. You can do some work. Yes, you should follow some precautions, but no, you should not mingle with a lot of people and people who are sick, but you can definitely do your normal things. Again, all patients will get the same chemotherapy. Again, false. I have an example to give. You have let's say you have TV channels, you have Zee, you have Sony, you have Tata Sky and stuff like that. Are all the channels the same? No, they are not. Similarly, everybody does not get the same chemotherapy. There's a person who came and told me, doctor, my sister-in-law got 4 cycles of chemotherapy. For me, you are giving 8 cycles of chemotherapy. Why is it so? There are different chemotherapies for different stage, which oncologists will basically tell. Now, this is what we all know, Manisha Koirala. This was she during her chemotherapy. This was she immediately after her chemotherapy. And this is the beautiful Manisha Koirala, which we all know after her chemotherapy. So it doesn't really, you don't really will lose all your hair. You will get your life back actually. Last 2 slides, all talk and something. Have we made progress? And there's a question which everybody asks, Achhe din aa gaye kya? So I'm not going to answer about the Achhe Din for the country, which I believe have come actually. But what I will show you is that in breast cancer, actually, in stage 1, you had 19, in stage 1, you have a 98% or 95% chance of survival. Stage 2, you have a 83% chance of survival of getting cured. Stage 3, you have a 70% chance of getting cured. Stage 4, you have a controllable disease, which is only 40% of people will live beyond 3 to 4 years. Imagine we are giving you 98% chances of cure in stage 1. How many people with a heart attack or a liver disease will give you that chance? Still, cancer is associated with stigma, which is something which I need to, which needs to go. Last slides again. This is BRCA1 and BRCA2 testing, which is made famous by Angelina Jolie. People come and say, get my both the breasts removed. I don't want to have cancer. People should please remember that Angelina Jolie had a BRCA1, BRCA2 genes, and she had an 87% chance of getting breast cancer if she lived up till the age of 70 years, and that is why she underwent. You need to be counseled in detail. You need to be seen by your oncologist, by your geneticist, before you do a BRCA1, BRCA2. Only 10% of BRCA cancer is hereditary. There are stringent criteria to do this testing. Blindly following Angelina Jolie may not be a very good idea. This is what I was speaking about, the survival for breast cancer. So this is my last slide, which says the breast cancer mortality, the mortality rate has come down. But as an oncologist, I want only 0% mortality with breast cancer. That is only possible if a lot of women come forward, if we are screening, and if the myths and facts about breast cancer are established properly in the eyes of normal people. So are we going to cure breast cancer? Not there yet. But definitely we are getting closer. And with this, I'll say thank you. And I hope I have been able to dispel some of the myths and tell you some of the facts about breast cancer. And I'll be happy to take some questions if there are. Thank you.
Thank you so much, sir. That was so informative and interesting. Now we open the floor for questions. We'll be taking 2 questions.
Yeah, I'll go first if that's okay.
Sure.
I saw you smiling a lot of times when the thing was being discussed, especially regarding biopsy.
Oh,
Tanish, I saw that. Yes, Tanish, go on.
Yeah, I mean, a lot of information was new to me. It was like the first time hearing it. And I'm actually like, although I wasn't sure how much I would be learning through all these presentations, I'm pretty sure that the result, the information that I'm getting is new to me. And obviously, I'm happy for that. So, I mean, I'll actually ask the question based on the last slide. The very last slide you said, which quoted that although we're getting near to the cure, it's not 100% there. So obviously the natural question comes to us is why don't we seek prevention? And obviously, other than screening that you mentioned in your presentation, are there any other methods, ways that one might know about the how to prevent and would understand how to self-diagnose before going for proper medications?
So I think a fantastic question, and mammography is just one point. The most important point actually is breast self-examination. So what happens is I, as an oncologist or a gynecologist, will see you only for 2 minutes. We do not know the women. We do not know your body. You know your body very, very well. So if you start doing a breast self-examination right from the age of 18 years or 23 years, you know your breast very well. If there is a lump, please go and talk to your doctor, your gynecologist, your physician, and get diagnosed early. Every day in our OPD, we see people who have been having this lump for 1 year, 1.5 years, and they say, doctor, it was not painful. Just because it was not painful, we did not go to the doctor. No, any lump in the breast, actually cancer lumps are painless. That is one of the anything which is painful is actually good, doesn't make a difference. So most importantly, a breast self-examination, again for women, do it when nobody is watching you. I mean, do it on the same day of the period. A good time to do is on day 5 of the period every month. Do it in the front of when you are changing your clothes while taking a bath. It just hardly takes 2 minutes or not even 2 minutes, but do it regularly. If you find anything suspicious, please go and report to your oncologist or to your gynecologist, any local physician, and get investigated.
Thanks for the answer, sir.
Yeah.
Thank you, sir. We'll be taking one more question.
Yeah. First of all, it's a great speech and very informative. So my question is, are there any lifestyle factors which can lead to a female developing breast cancer? Was I audible?
Yes, I think there's some network issue in sir's side because he has frozen.
All right, yeah.
Can you hear me?
Yes, sir. Yes, sir.
Okay, sorry. I think I had some internet troubles. So a very good question. So the lifestyle factors can be divided into two. One is controllable, one is uncontrollable. So the fact that you are born a woman is an uncontrollable factor. Early menarche, that is the time when you start having your periods, and late menopause. Again, the more estrogen exposure, you can't change anything. But what you can change is if you have good physical activity, if you don't take more Western diet, if you do not take, if you do not take more of OC pills more than 5 years of age. So if you maintain a good diet, good physical activity, obesity, prevent obesity. If you do not take hormonal pills, the chances of getting breast cancer actually reduce. Having the first childbirth before the age of 30 years also and breastfeeding. These are the 5 or 6 risk factors which will help us in decreasing the risk of breast cancer. Again, very important to know, this will not make it zero. But if somebody doesn't do that, they have a 1.2% chances higher of getting breast cancer rather than somebody who does it actually.
All right, so thank you so much.
Thank you so much, sir. So we know what we are going to say now. Hence, we are in this together and we will together create a future without cancer. Thank you again, sir.
Thank you. It's so nice to see youngsters coming and having this talk actually. I'm really really happy because you guys are the future. I mean, not that I'm very old, I'm quoting it right now, but youngsters coming up, it's always said, if you want to change a nation, change the child, educate the child. And it's good that you guys are doing that. Wonderful job. Thank you.
Thank you, sir. So now it's time for some more poetic inspiration to hit us today. We invite Anya Narula, who has also won the second runner up in the open mic competition we had held for this event, to share her writings with us on our virtual open mic stage.
Am I
Anya?
on?
Yes,
Yeah,
you're audible and you're visible.
thank you. A very hearty good evening to all. For the event Open Mic, I have written a poem and it goes like this. I hope you all like it. What's in the mind that can't be threaded? Perhaps it's the meaning of life. Why does she live at the brink of life and death forever? In the nights of fight, she was not relaxed by setting foot in the sea of death. She thought to herself, why was my life waiting for me? Her illness gave her pills, snatched the hair and the dew of life, and gave her the fear of losing herself. Ah, cancer, she was living, but not alive. It's evil and deadly, a silent killer. It sneaks like a thief inside the body and destroys the will to live. Cancer is a beast. It steals away love. Alas, cancer's presence makes her weep as each day runs shorter. Her diagnosis was a punch that left her wounded forever. But cancer can take away hair, but not your flair. It can take away comfort, but not the comfort of memories. It can take away life, but not the heart of being alive. If you carry dreams in your eyes, then you are alive. If you carry surprise in your eyes, then you are alive. If you carry impatience in your heart, then you are alive. Learn to flow like the sea does as waves. Every moment is a new beginning, seeing with your eyes. Thank you.
Thank you, Anya. That was indeed inspiring. And we know what we're going to say. Hence, we are in this together and we will together create a future without cancer.
Cancer patients undergo an unimaginably painful experience. Along with them, their family and friends feel the pain as well. While the disease does take an enormous physical toll on the individual, the mental toll is equally heavy. And in times when mental health is being talked about more, we at EHCF felt the need to talk about it in the context of cancer. Hence, we invite Dr. Pradeep Saha to share his views on mental health of cancer patients and their families. Dr. Saha is a professor and director of the Institute of Psychiatry, IPGMENR, Kolkata. He is also an honorable research awardee, 1998, and president of the Regional Psychiatric Assembly, 2000.
A very warm welcome to you, Dr. Saha.
He is facing some network issue. He has just messaged. So if he is not available, please ask someone else.
Okay, please contact him and let us know. Prisha, could we please have that song?
Yeah, just a second.
So meanwhile she connects, let me tell you, we all saw um, Mrs. Goel's dance, heard her share her experience with us. And this is from Mrs. Uma, from her group. She is 71 years old and has the spirit to be a warrior. So let's hear her sing, which she recorded during her treatment days.
मनुष्य जन्म अनमोल रे, इसे मिट्टी में मत घोल रे। अब जो मिला है फिर न मिलेगा, कभी नहीं कभी नहीं कभी नहीं रे। राम नाम तो बोल रे, जीवन में रस घोल रे। अब जो मिला है फिर न मिलेगा, कभी नहीं कभी नहीं कभी नहीं रे। मनुष्य जन्म अनमोल रे, इसे मिट्टी में मत घोल रे।
কে ওরা ধরতে পারছে না, আমি তো দেখতে পাচ্ছি।
Whose
Hello.
mic is on? Yes.
Yes, ma'am. Do you hear me?
Dr. Saha, a very warm welcome to you.
Yeah, thank you. So thank you, ma'am. As I got the opportunity to say something about my subject related with your programs, that oncology and psychiatry. say these topics I have discussed under the following headlines. And at a glance, I must say on the under heading of the introduction, next I will talk about the psychological factors affecting cancer risk and progression. Then I will come to talk about the common psychological responses to the cancer patients and psychiatric disorders in cancer patients used to come across all over the world and factors in adaptation to cancer. General principles of assessment and treatment in case of psycho-oncology. So on introduction, I must say the terminology, what does it mean, the psycho-oncology? The psychology means the study of the psychological aspects of the cancer along with the continuum from prevention to cure. And that psycho-oncology addresses the psychological response to cancer of the patients, and not only the patient, their families, and also the healthcare providers. And it also addresses the psychological, behavioral, and social factors that influence cancer risk and its detection. And the most important thing is survival. I must say about the American Psychological Oncology Society is a multidisciplinary national organization representing the subspecialty of the psycho-oncology in the United States. And there is another organization, the International Psycho-Oncology Society. And your society is one of the most international organizations that was formed, in which you know better than me, and in recognition to the need for the communication among professionals with interest in psycho-oncology worldwide. And most of the cancer centers have an identified member or members responsible for providing psychosocial support that is very much important. And the clinicians like us and the researchers from psychiatry, psychology, social work, nursing, and clergy constitute the members of multidisciplinary psycho-oncology teams. And these teams usually provide consultation to patients and their families, and the liaison services to oncology staff, as well as collaborate with investigators, studying the impact of therapeutic interventions on quality of life and patient-reported outcomes. The clinical practice guidelines have been established based on evidence from existing research till today. The communication skills training programs have been developed by psycho-oncologists for oncology staff, and that is as effective communication impacts the care of the patients with all cancer types, in all stages of cancer, and each step of treatment. Researchers are more actively exploring the social, psychological, and behavioral contributions to cancer patients, early detection, and again the survival. The research examining the mechanism of cytokines in producing cytokine-induced sickness behavior may provide a biological basis and a novel treatment options for common symptoms like fatigue, depression, anxiety, and as well as cognitive changes in all cancer patients. Now coming to the psychological factors that affecting the cancer risk and its progression. The role of psychological factors in cancer onset and its progression is, though it is controversial, but there are large number of epidemiological Western electric study, and that study done by the Shekel and his associates, and it was published in 1981 in Psychosomatic Medicines. And there is a Persky and his associates that is also published in 1987 in the Journal of Psychosomatic Medicines. That large epidemiological Western electric study reported that depressive symptoms, if it persists for a long period, are associated with twice as high risk of death from cancer. I mean, it is persists for 17 years later, and with a higher than normal incidence of cancer for the first 10 years and at 20 years follow-up. However, other studies, including a prospective large cohort study, found as such there is no effect of depression as a risk factor on cancer risk. So depression may affect the course of the illness in patients, not only as a aggravating factors with cancer because it results in poorer pain control with poorer compliance and less desire for life-sustaining therapy. The research over the last 25 years has both supported and sometimes refuted the belief that cancer development or mortality is influenced by the coping skills of the person concerned, the defensive style,
I think he lost his network. That's why I can't see him in the participant list as well. We'll just try to contact him. Mansi, have you got anything to say?
I do just like to say, Megha, that this definitely feels like the celebration of life and spirit, with our distinguished doctors delivering such wonderful speeches, their presentations, and such essential inputs that they're giving to us today. And the beautiful performances by our cancer warriors like Mrs. Uma. Since we are unable to connect with Dr. Saha right now, I think we can
We
move
have
on.
him back. Just a second.
Oh.
Dr. Saha?
Hello. Yeah,
Yes,
sorry
sir.
for the interruption. There is
No
some
problem,
disturbance
sir.
with internet. Should I carry on?
Yes, sir. Yes, sir. Please.
Yeah, please. So we are talking about the depression. Yeah, the depression may affect the course of the illness, not only the aggravating factors or precipitating factors in cancers. By many studies already have mentioned, it was published in Psychosomatic Medicine in the year of 1984 and 1987, that the illness of depression in patients with cancer, it results in poorer pain control and poorer compliance and less desire for life-sustaining therapy. The research over the past 25 years has both supported and also refuted the belief that cancer development or mortality is influenced by coping, defensive style, or personality traits. Now, coming to the common psychological responses to the cancer. The diagnosis of cancer creates a crisis, requiring the patient to adapt quickly to catastrophic news. And the major concerns are fear of death, fear of dependency, fear of disfigurement, fear of disability, fear of abandonment, as well as disruptions in relations, role functioning, and financial status. The diagnosis of cancer induces distress, and the individuals show an initial characteristic response of shock and disbelief that usually lasts less than 1 week. Patients usually try to control the level of emotional distress while making crucial treatment decisions. And presence of a relative or friend, this is very important. Presence of a relative and friend can help with the processing of important information. The way the news is conveyed by healthcare professionals can influence a patient's belief, patient's emotions, attitudes toward the future, as well as the medical stuff. The second phase of response to diagnosis is characterized by a period of commotion with mixed symptoms of anxiety, depression, irritability, insomnia, poor concentration, and inability to function. So these all symptoms usually begin to resolve the support from family and friends and from the physician who outlines the treatment plan that usually offers some hope. This phase usually lasts for 1 to 2 weeks. During the third phase, the patient adapts to the diagnosis and treatment, and the patient returns to previously used coping strategies that are helpful in reducing stress or distress influenced by the previous level of maturation and adaptation. These psychiatric disorders in cancer patients is also very important. First of all, I will discuss about the depression. The so-called cancer or carcinoma is associated with a higher rate of depression than in general population, comparable to other serious medical illnesses, and most of the time represent a normal reaction in psychiatric disorders or a somatic consequence of cancers or its treatment. Cancer types particularly associated with depression include oropharyngeal, hello? Do you hear me, ma'am?
Yes, sir. Yes, sir.
Yeah. The cancer types particularly associated with depression include oropharyngeal, pancreatic carcinoma, the breast cancer, and lung cancer. This is important. The cancer types particularly associated with depression, in most of the cases, those are having the oropharyngeal cancer, pancreatic cancer, breast cancer, lung cancers. I'm not talking about the others. Because cancer may itself cause anorexia, weight loss, fatigue, and other vegetative symptoms, and diagnosis of clinical depression relies more heavily on psychological symptoms like social withdrawal, anhedonia, dysphoric mood, feelings of worthlessness or guilt, poor self-esteem, and suicidal thoughts. An increased risk of suicide in cancer patient is associated with advanced stage of disease, poor prognosis, sometimes in a state of acute confusional state, inadequately controlled pain, depression, history of psychiatric illness, substance abuse, previous suicidal attempts, and social isolations. And passive suicidal thoughts are far more common than true suicidality in cancer patients. This is important. And yet, may be expressed in some patients, non-compliance with or refusal of treatment is most common in terminal stages. Now, coming to the anxiety. That anxiety leads some patients to deny and sometimes ignore the cancer symptoms, and sometimes it delays seeking medical attention. Sometimes symptoms of anxiety are common after initial diagnosis of cancer in making treatment decisions and when worrying about recurrence or progression. Specific anxiety syndromes can interfere with treatment, and patients with claustrophobia have difficulty tolerating magnetic resonance imaging scans, sometimes radiation therapy. Sometimes there is a radiation phobia, makes some patients reluctant to accept radiation treatment. Now, I'm coming to the psychosis and delirium. So among the psychosis, the mania is most common. That mania in cancer patients is usually due to pre-existing bipolar disorders or high dose of corticosteroids, usually most common as because most of the cancer patients in the course of treatment, they used to get some high dose of corticosteroids, and only rarely due to other drugs, as for example, interferon or brain tumors. Now coming to the acute confusional state or delirium is common in cancer patients as a result of the disease and its treatment, and particularly in the terminal stage of illness. The specific causes of delirium include brain tumors, whether it is a metastatic in origin or primary in origin. In anti-neoplastic drugs, say for example, cytarabine, methotrexate, and immunotherapeutic agents, usually most of the time we are used in case of cancer patients, in many cases, interferon, interleukins, and sometimes infection, especially in immunosuppressive patients, and some antimicrobials, as say, for example, amphotericin, opioids, hypercalcemia, and the rare, the paraneoplastic syndrome, limbic encephalopathy. Now coming to the factors in adaptation to cancer. So factors in adaptation to cancer, I must say, the patient responses are modulated by factors derived from the society, the patient, and the cancer type. There are three things. One is society and the patient itself and the cancer type. The society-derived factors reflect society's attitudes towards cancer and its treatment, as well as its perceptions and knowledge of cancer at a given time. Now, coming to the most important thing is the legal requirement of the informed consent has improved communication between the physician and the patient about illness, about treatment options, about prognosis, and participation as a part of the treatment. Next, the patient-derived factors that modulate adaptation to cancer originate from three sources. One is interpersonal factors, second is intrapersonal factors, and third is socioeconomic and social class. First, we will talk about the intrapersonal factors, which include pre-existing character style, coping ability, ego strength, developmental stage of life, and the impact and meaning of the cancer at the stage. Now, coming to the interpersonal factors, refer to the social support derived from others. This is very important. And socioeconomic status influences the third set of patient-derived factors. So, these cancer-derived factors that related to the characteristics of the disease itself, such as stage of the disease, the symptoms manifestations, the site of the cancer, the prognostic point of view of the cancer as a whole, and type of treatment he or she is getting, and finally the impact in functionality. So now coming to the general principles of assessment and treatment in psycho-oncology.
Sir, I'm so sorry to interrupt. We are running out of time.
I need a few 2-3 minutes.
Sure. This is just a reminder.
Yeah, okay. The hallmark of treatment in psycho-oncology is therapeutic activism with the simultaneous use of several modalities in an aggressive attempt for rapid relief of symptoms. Psychiatrists must be prepared for existential plight of the cancer patients, who intensifies the expectable counter-transference reactions, and they must resist the urge to distance themselves from a painful situations while guarding against over-involvement. So the assessment and treatment continued, psychiatric point of view, medical point of view, and environmental factors, including interface with the family, interface with the medical team. So assessment and treatment, the psychopharmacology. In mildly confused or anxious patients may benefit from a low dose of antipsychotics such as olanzapine, risperidone, and quetiapine at bedtime. And short to medium acting benzodiazepines also sometimes helps a lot. And the telephonic counseling, the help of the internet and use, and educate the patients, sometimes group interventions, and informal patient-to-patient contacts through the chat room format is also helpful. And psychotherapeutic modalities such as cognitive behavioral therapy, sometimes crisis interventions, problem-solving techniques, group psychotherapy and supportive psychotherapy is very much helpful. And structured interventions are very, very efficient, showing benefit after a brief course of treatment. So psychotherapeutic interventions as a whole is very much important, not only the psychoeducations and psychotherapeutic interventions. Two major issues I should mention here for the patients are the reality of living a shortened lifespan or the coming of the death. The psychiatrists must overcome their own reflexes to stay with the first issue, that is living a shortened lifespan, and to avoid the second, that is the coming of the death. The next is the meaning-centered psychotherapy is a novel modality that is designed to help patients with advanced cancer to sustain or to enhance a sense of meaning, a sense of peace and the purpose in their lives, even as they approach to the end of the life. And the behavioral techniques, say as hypnosis or self-hypnosis, active and passive relaxation, sometimes desensitization and distraction are useful in a wide range of situations in oncology, including relief of acute anxiety and chronic anxiety. And the social services It's also very important that they provide extensive psychotherapeutic support and they perform a triage functions, altering staff to patients with serious psychopathology. Their classic role is to help patients and families just to find their way to available researches, which is often the most helpful intervention that patients identify. Thank you. Thank you, madam.
Thank you so much, sir.
Yeah.
Mansi, you have something to say?
Thank you so much, sir. Your presentation was extremely informative and it really helped us a lot. Today's discussion, as I just said, and I think was the reminder for this entire webinar, that today's discussion certainly feels like the celebration of the gift of life. And thanks to the wonderful and essential inputs by distinguished doctors and the beautiful contributions of cancer warriors like Mrs. Uma. Hence, we are in this together and we will together create a future without cancer.
Yeah.
So before proceeding, can I have everybody switch on their cameras? We'll take a picture, and the news way of taking picture is screenshot. So all our volunteers here on Zoom, all the doctors, our esteemed guests, everybody, a picture time. Switch on your cameras, just 1 minute.
Yeah.
Okay, I'll be counting down from 15 and you all have to turn your cameras on by then. Okay, so 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and say cheese or whatever you want to. So the picture time. Right, one picture done. Let's take one more. I can see all of you prepared for the picture pretty well. So one more. Okay. Perfect. Oh, what nice pictures we have. You all will get it in the newsletter. So yes, wait till then. Now, continuing with the session. Prevention is always better than cure. This mantra stands true for every disease or infection, cancer too. To enlighten us more about the subject and help protect ourselves from the looming infection, we cordially invite Dr. Kumardeep Datta, who will be explaining preventive measures for cancer with special emphasis on diet and nutrition. Hope our online audience across all platforms are paying keen attention. Dr. Datta Chaudhary is an experienced medical oncologist with more than 10 years of experience who had been conferred with Samita Mishra Memorial Foundation Award for Cancer Research Excellence for active role and leadership in Cancer Bhagao campaign. He is presently a senior consultant at Medical Oncology Fortis Hospital, Noida. Over to you, sir. Very warm welcome.
Hi all. Thank you, Ratnada, for giving me this opportunity to speak on this August gathering. I hope I am audible.
Yes, sir. You're audible and visible.
Right. So basically, prevention, as aptly said, prevention is better than cure. So there are certain factors in cancer which are non-preventable, non-modifiable. Like for breast cancer, being female is at a higher risk. You cannot change that. Or if you have any family history of cancer, you can't change your family. So it is, or if there is any genetic part of it which cannot be changed. But what is in our hand, our daily activities, our exercise, our dietary habit, whether we are following Western type of diet or Indian type of diet, that is, these things, few of the things are in our hand. So these factors are very much modifiable, and these are responsible for quite a large number of cancer. I can name few like CA breast, CA gallbladder, liver cancer, kidney cancer, mouth cancers of all part of the mouth and voice box, esophageal cancer, stomach cancer. Because of our lifestyle habits, because of our eating habit, these are the types of cancer which can occur. Now, what are the lifestyle factors which can cause cancer? There are few types of addictions. As we know, these are well-known. Smoking, alcohol, these are the two risk factor, most important risk factor for mouth cancer. India, especially from the northeast and eastern part of India, we see maximum number of mouth cancer, maximum number of head and neck cancer. It is all, most of the time, 99% of the cases are associated with the smoking. And when a smoker drink alcohol, the risk is not additive, it is multiplicative. So that is one part of it. Addiction is one part of the risk factor. The other risk factors are our dietary habit. As I can see, in our childhood days, our diet was more of Indian. Nowadays, as the days are passing by, it is becoming more and more, it is becoming westernized. The presence of highly polished food, processed food products in our diet is increasing day by day, which is not healthy. Maybe these are more tasty, but these are absolutely non-healthy foods, especially processed foods and highly processed foods like ham, burger, or hot dogs, which are almost like most of the every other household, it is very common taken. And especially red meat is again another culprit which increases the risk of cancer, especially breast cancer in female, GI cancer, intestinal cancer, colon cancer, endometrial cancer in female, and cancer of food pipe, that is esophagus, stomach. All these are responsible for this. And day by day in our diet, amount of the fruits and vegetables are decreasing, especially in the urban areas, it is decreasing. Whereas we know from ages, presence of cruciferous vegetables, they can prevent cancer. Cruciferous vegetables like broccoli, cabbage, cauliflower, and beans, like including peas, which are high content of fibers are there. So whenever we take fiber-rich diet, our bowel habit is regular. There is no constipation. So we pass stool daily, at least once a day. So that is also essential. Why it is essential? Because whatever is formed in the intestine, like stool, they contain a number of carcinogen which can cause cancer. Now, if these are not flushed out daily, they can initiate cancer in our intestine. So whenever we take history of a anal canal cancer survival or colon cancers, or the patient who are having rectal cancer, most invariably they complain of chronic constipation. It is a common factor which is responsible for most of the large bowel cancers. Why constipation is responsible for cancer? Because all these carcinogen which are present in our stool, they get more time to get absorbed from the intestine, and they are triggering cancer. So in that way, extra fiber, if you take in our diet, that will prevent us from these intestinal cancers. Now, where from these fibers come from? If we take a large amount of unprocessed foods which contain fibers, they are rich in fibers. If we take large amount of processed food, like in wheat also, if you take maida, atta is definitely better than maida. because atta contains, the fiber content in the atta is better, more than the maida. Then a high intake of salt, high intake of cured meat or processed meat, all these are increasing day by day. That's why, because if we think of, because I have started practicing oncology 15 years back. At that time, the incidence of cancer was not that high. It is almost doubled from that time. Why? Why it is so? Because even if you see 2 years or 3 years old children, they are also demanding for this fast food. Whenever their parents are carrying them to a grocery shop, they will point their finger towards those fast food packets. Kurkure. They want kurkure. And for the parents also, to make them calm, it is easier to give a kurkure. Yes, le beta kurkure lo. But what is the long-term sequela of all these wrong food habits, developing wrong food habits? It is because nowadays we are seeing more and more patients are coming in their 20s, 30s, unmarried females with breast cancer and advanced stage breast cancer. Whenever this cancer, mind it, whenever this cancer happens because these are typically for the elderly population, 50, 60 plus. But whenever these cancers are shifting their age, it is becoming more aggressive. So a cancer, especially breast cancer in the females at 50, 60s, and a breast cancer in female of their 20s or 30s are not same. It is more aggressive in the younger adults. And why it is happening? Why there is a demographic shift of all these cancers? It is because of our lifestyle. It is because of the food habit. Where it is day by day, this cancer is increasing because we are changing our diet pattern toward the Western diet. We are taking more of processed food. Earlier, we used to take a lot of fruits, a lot of vegetables, because these fruits and vegetables are rich in minerals and the vitamins, which are protective foods. Nowadays, this amount of the fruits and vegetables are decreasing. The amount of the processed and red meats, which are increasing day by day in our diet, leading to abnormality in our bowel habit, abnormality in our sleep pattern. Everything is responsible for increasing incidence of cancer. So whenever you see the prediction for next 10 years of the cancer, it is doubling, tripling at any rate. It is fastest growing, one of the fastest growing disease. It is all because we have changed our lifestyle. All these lifestyle factors, because genetic is not changing. It is for thousands of years, it is same. The genes are same. The Indian genes are not changing. What is changing? What is responsible? What is increasing the incidence of this cancer? It is because our diet, our lifestyle. We are becoming more and more sedentary. We are sitting hours together in front of televisions or in front of laptop, with the laptop or with the computers. The more and more our life is becoming sedentary, more and more the chances of, because most of the cancer increases if we our activity decreases. The most of the cancers, including head and neck cancers, breast cancer, endometrial cancer, liver cancer, kidney cancer, name any organ, and all the organ, if you put on weight, the chances of getting these cancers are high. So at least what is recommended, at least 150 hours of moderate activity per week is recommended for the adults. What is moderate activity? At least cycling or baseball, volleyball, or any double tennis play, or gardening. At least 1 hour of gardening daily, in home gardening or mowing of the lawn. Or the best is walking. Brisk walking is the best exercise. At least that can be done. Gaining weight is always inviting cancer. Apart from all this cardiac problem and all, blood pressure, diabetes, blood pressure and cardiac problem, it also increases the risk of cancer. And most of the cancer increases if you put on weight. So it has been advised that we should maintain an ideal body weight. What is the rough estimate is, what is the rough estimate for ideal body weight? Anybody's height in centimeter minus 100. it should be the ideal body weight. So we have to maintain the ideal body weight. We have to maintain a healthy diet. Earlier, what people used to take a lot of fruits, lot of vegetables. They used to pass a lot of stool every day. Nowadays, people, most of the people, especially in the urban centers, what we see, people are constipated and they are passing stool in every alternate day or thrice a day. If you see the American definition wise, is it abnormal? No, it is not abnormal. They say 3 times per day to 3 times per week. That is passing stool 3 times per day to 3 times per week is normal. 3 times per week means every alternate day. It is because average American diet, they take a high intake of meat is there, red meat, especially red processed meat is there. So obviously because of the high protein intake and high meat intake, they are constipated. So every alternate day, if they pass stool, it is considered normal in the American society. But it was not till few years back, it was not considered normal in the Indian context. But nowadays we are getting more and more people coming up with the chronic constipation, the problem of chronic constipation. It is nothing but because of the 2 factors, because of less fiber in diet and sedentary lifestyle. Because most of the people, they are working on computers. Most of the people, especially in the COVID era, they have worked from home. So again, the level of activity is less. So all these are contributing to the high risk of cancer. Again, psychological aspect is also there. We have seen many patients who are presenting with the deficiency of multiple vitamins and minerals, especially vitamin D deficiency, highly prevalent in Delhi NCR region. Every other guy, whenever I advise for the vitamin D, it is coming, invariably it is coming 100% of the cases, it is low. Why? Because nil sun exposure. We stay in air-conditioned home, our car is air-conditioned, office is air-conditioned, so where is exposure to sun? So there is no exposure to sun, no vitamin D, and vitamin D deficiency is again responsible for many types of cancer. So again, most of the time I had to supplement vitamin D. Again, in the Indian context, there is another problem, the tropical screw, because most of the patients have malabsorption syndrome. Vitamin D is a fat soluble vitamin. So vitamin D deficiency is always prevalent because of probably dietary malabsorptions and all. So supplement vitamin D. Most of the time, when the people are also getting supplemented vitamin D in the form of oral tablet or oral sachet, the vitamin D is not getting absorbed because of the malabsorption syndromes. So ideal way of substituting vitamin D for these patients are intramuscular vitamin D. Again, calcium deficiency has been linked with many cancer. Calcium deficiency, because when there is a deficiency of vitamin D, calcium absorption will be impaired and leading to low level of calcium. Again, low level of calcium is responsible for multiple types of cancer. But excess of sun exposure can also lead to melanoma, which is a type of skin cancer. It is not that prevalent in India. It is more prevalent in the Australia, New Zealand. It is highest incidence is seen in Australia and New Zealand because of high exposure because they had it like freckling in the skin and all the predisposing conditions for the multiple melanoma. So it is high in those countries, but India also we see this type of patients. It is due to exposure to ultraviolet B radiation. It is a type of skin cancer. Then,
sir, I'm so sorry to interrupt. We are running out of time.
Right. So, my concluding in conclusion, I would like to say that we should take a wholesome diet, and we should more focus on the typical Indian type of diet, which was good for our health, overall health. It is not for the cancer, but also for the heart, good for the heart, good for or immunity, good for diabetes, because all these foods, processed foods, salt, sugar, high intake of all these things are responsible not only for the cancer, but also for diabetes, also for hypertension like high BP, also for poor cardiac health status. So at the same time, we have to take care of our diet as well as we have to exercise regularly. With this, I'll conclude my talk. Thank you.
Thank you so much, sir. It was such an honor to have you amongst us. And you know what we are going to say? We are in this together and we will together create a future without cancer. I now request our national advisor, Mr. Datta, could you please share your views about this ongoing event? Please unmute yourself, sir.
Namaskar. Greetings to all on the occasion of World Cancer Day. The World Cancer does not evoke fear among the masses as it used to be, say during 3 to 4 decades ago, thanks to the advancement of the medical sciences and understanding of the disease. Cancer in one form or the other has touched directly or indirectly almost all of us, all the families worldwide. Here too, I have an experience to share. My father-in-law had throat cancer twice. First time he got treated at CMCH Vellore, and second time at AIIMS Delhi. The gap between first and the second occurrence, the gap was about 10 years. He couldn't complete the dose of the therapy. Surprisingly, he survived for the next 24 years after being detected with cancer and enjoyed his life till the age of 86. As laymen, we realized that timely detection and early start of the treatment were instrumental in his case for long survival. Moreover, he used to practice yoga, meditation, light exercise, as we call Shukshma Vyayam, regularly, and also took healthy vegetarian diet. This helped him to survive bundles of usual complications that radiation therapy brings in. Mentally, he used to stay positive and had immense belief in the power of Almighty and his Guru. In fact, he expired due to old age and other complications that arose because of radiation therapy, but not due to cancer per se. Awareness about cancer is there, but more awareness with survivors' success stories radiating hopes all around is the need of the hour. And that is precisely what today's event of the Advanced Healthcare Foundation is tries to propagate. And my sincere gratitude to all those viewing this program today. Thank you all. Namaskar.
Thank you so much, sir.
Thank you, sir, for your kind words. Last but not the least, we now have the winner of our poem writing competition taking center stage. Our final open mic performance of the evening is by Urshita Ray.
A very good evening to one and all. The title of my poem is The Turning Point. The Turning Point. As I sat beside the windowsill, recalling the memories unfond that plagued my mind and soul for the past 7 years, weren't they more like 7 centuries? Each day, each moment, brimming with insecurity, uncertainty clouding like a fog, as a tumor pervaded my brain, destroying my willpower and determination, splotching my dreams and aspirations. My dense, luscious ebony hair replaced with someone else's biological possession, and genuine smiles that greeted me replaced with sympathetic frowns. A typical victim of a typical stereotype. A single question. Silence was the only answer. Why me? Sleepless nights and gloomy days, encompassing me with hopelessness and rage that surpassed all rational, regret of feeling left out, of fond memories of not prioritizing my home over others, my home, my body. Frustration turned into agony, hopelessness into despair, all kinds of emotions on the verge of brimming out. Days of experiencing a myriad of emotions, the deep rooted desire for change, for growth, for enrichment of the soul, to infuse a sense of willingness to try one more time, to get up one last time, to realize that the world, quoting John Green, isn't a wish granting factory. Sitting like a duck, moping around, sympathizing with myself was irrelevant, and that was the beginning of my 2 year long journey towards one goal: normalcy. Positivity and self motivation had acquired the rank of best friends, and my mentor, life, who taught me that every moment, big or small, is precious and that time waited for none. As the famous saying goes, God helps those who help themselves. He indeed did help me overcome my malady, even when the doctors had lost all hope, hope that shows us light at the end of the tunnel each time darkness and despair closes in upon us. Hope that wins lost battles. Hope that reincarnates the buried despair. That was the moment when I looked back at that thought, that one single thought, which became the catalyst that inspired me to become what I am today, an atypical victim of a typical stereotype. A small, unsuccessful try is still better than the lifelong burden of regret. Thank you.
That was absolutely beautiful, Rishita. Thank you so much. With that endearing poem, we now come to the end of our event. Before moving on, the winner of our poster making competition on World Cancer Day will now be announced. If we were in a typical setting, I would ask you guys to guess who it is. But, anyways, the winner is Khushi Verma. It was a very close competition between Chelin and Khushi. Khushi's poster has 200 likes on Instagram, while Chellin's has 185 likes. So it was just 5 likes that got Khushi the winner's title. And I hope there are some people having their virtual applause for Khushi right now. So congratulations, Khushi, for winning our poster making competition. I would now like to invite Dr. Saurabh Kore, Director of Advanced Healthcare Foundation, to deliver the vote of thanks.
Dr. Kole, please unmute yourself. We can see you. You are in the hospital attire.
Can you listen to me now?
Yes, sir, we can listen to you.
Okay. So thank you very much. And it's a wonderful program. And I'm really grateful to all the speakers who have given an excellent speech, and the young stars who had made it possible. Actually, Advanced Healthcare Foundation, we have started in 2013, and we have organized many programs earlier on critical care, adolescent health, and we have also actively participated in disaster management also. So cancer is an important topic today, and many people are dying of it. And we have seen recently the death toll of the COVID also. And I think that if we are becoming more aware of this deadly disease, probably many a disease can be prevented. I should say that the Dr. Dibyendu Banerjee, who has spoken something regarding the vaccines, and I think that the vaccine is an important issue all over the world today. And we know that before the year of 1900, this average age of the people was around 39 years. Now in India, it's almost more than 64 to 65 years. So vaccine plays an important role of this well-being of the people of our country. In fact, all over the world. So the vaccines are of immense importance, and if any other preventive measures like regarding the this food habits is of immense importance. Tobacco smoking, to prevent tobacco smoking, which has been rightly pointed by Dr. Rajesh Gupta, and it is also of immense importance. And Dr. Ullas Batra, who has told about even if the self-examination, and if we can identify the breast cancer in early stage, probably the outcome will be definitely better. And Dr. Pradeep Shah, and he is a renowned psychiatrist of the Eastern Zone, and many a welfare program he's always involved, and we are really we are really indebted to him, because that this regarding guidelines of mental health is of immense importance. Both the patient party and also the patients, they have some psychological problems, starting from the disease itself to the financial problem and overall the family problem. All these are of immense importance. So mental support is of immense importance in the cancer patients as also their parties. So regarding the say that whenever we are thinking of that willpower, how we can defeat the cancer, these sort of poems, these sort of competitions, and actually it is also very much helpful. It actually it increases our inner power so that we can fight against this deadly disease. So we are here, and I am sure that in future we will be in many other programs also. We will get the help of you, and I am sure that in future Advanced Healthcare Foundation will take more programs constantly on cancer awareness, and your presence and your help will be definitely helpful in the future program of our Advanced Healthcare Foundation. Thank you very much.
So thank you all, and I think our strength is these young adults or adolescent children, and they really organized a very, very good program. I must appreciate them, and thank you all for this.
And lastly, I forgot to mention Dr. Nathani. Dr. Nathani, are you here? Srinidhi?
No, she is not here.
Okay. So thank you very much.
Thank you very much to everybody. Thank you to our honorable speakers who are here. Dr. Rajesh Gupta, Dr. Dibyendu, Dr. Batra, Dr. Saha, Dr. Datta, our cancer warriors like Mrs. Goel, the directors of Advanced Healthcare Foundation, of course, our advisor, sir, our volunteers, without whom today's event or any event we do in this adolescence vertical or related verticals, it wouldn't be possible without you or my Adolescence Development Club. So thanks to each and every member present there for your personal contribution. And of course, thank you to our online audience here on Zoom or on YouTube Live. Thank you so much. And congratulations again to all the winners who won in our poster making or our open mic contest. Congrats. And hope to see you all again soon. Till then, you can follow our Instagram page at AHC_Foundation. Follow us on Facebook, Advanced Healthcare Foundation. And of course, don't forget to subscribe our YouTube channel for further updates, for further events, and hope to see you all again soon. So, a ceremonial bye.
And our next program is on 8th March.
Oh, so here you
Women's
have
Day.
the good news. Already declaration of the next program. So 8th March, book that date. Mark it on your calendar with a big red cross. So see you there. Bye.
Thank you, everyone. See you soon.